word I'd probably use is just exhausting. There's just a certain amount of psychological exhaustion, just having to, think about this, all the time. That's always on your mind. And then there's a certain amount of just kind of physical and emotional, just kind of fatigue. I think you keep kind of moving the bar of how long you think you're going to have to kind of prepare and endure. The analogy I tell people that COVID to me is a bit like playing a game where it's set on moderate level, and COVID's kind of like someone just kind of went to the back of that game and just turned it to super hard level. And you're kind of doing the same stuff, but you're just having to do it that much better, that much quicker, and that much more efficiently to kind of get to the same aim. It's amazing to me just to be able to see the patients that I admit where, one patient seems to have all the signs and risk factors to have severe disease and really kind of floats through, without a real severe course, while next door is an individual that seems to be healthy, not really carrying those risk factors, and is literally fighting for their lives. And I think it's just humbling to kind of know how quickly, some of these patients can decline. It's hard when it's unexpected, and it's hard to have those conversations with family that is dealing with that kind of shock and surprise. So what keeps me up at night is not as much a preoccupation of just an overwhelming morbidity and mortality from COVID-19 directly. What worries me with COVID-19 is that you're having enough patients being admitted, both here and in our tertiary care facilities, that those other, routine emergencies, those heart attacks, strokes, and trauma that come in, I worry will quickly be at a point that I'm not going to be able to transfer those patients routinely to those usual areas. Anecdotally, a month ago, I've had multiple patients that I had to transfer to La Crosse, Wisconsin to ICUs because it was the only ICU beds available. We've been at ICU capacity in the metro facilities for weeks. I worry that you have healthcare systems that are talking about resource scarcity. And talking about who they allocate resources to, in settings of surges, which is never anything I felt like I would be living through. I think everyone is a bit different in terms of how they assess or experience risk, with this disease. And I think, unfortunately, that bar keeps moving based on how prevalent the disease is in our community. I can completely understand how this pandemic has impacted patients in a negative light health-wise, but also economically and socially. And I empathize with that. I do. I look at it that we don't have individualistic aims here, and I look at it that there's a community good to me, which is greater than anything that I see collectively of the individual needs of us as people. My message is in terms of support and kindness for each other, and promotion of health for our community. I think it's important that this extends beyond ourselves in terms of wearing masks in public, following our precautions. This is not about you or me. This is about us collectively.